for appearing before us today. I think we all know that public servants are unsung public heroes in this crisis, and I'm glad we have an opportunity to express these sentiments to you. I have 3 questions. My first 2 are for Dr. New, and I'll ask them one after the other. You spoke, Dr. New, in your presentation about communicating with Canadians, and that's certainly a really, really important function. But just as there is information, there is also misinformation and disinformation. And the pandemic has been accompanied by an infodemic. Ryerson University recently did a survey which found that 7 out of 10 Canadians had received misinformation about the crisis and about solutions and stuff like that. What is your agency doing to combat misinformation?
Thank you very much for the question. And you're right. We're certainly well aware at the agency that there is, as you say, an infodemic and certainly a great potential of what we call misinformation. And so there's a number of things that we're doing. Certainly, we've, especially for misinformation on the what we call social media networks and the internet, we've been working closely with the big providers, like YouTube and Facebook, et cetera. And they have also, I think, put in various, I'm not a technical expert, filters, and also putting what they might call trusted sites higher up in terms of their we call it search engines and so on. And so with that, it's minimizing, but I wouldn't say that it's 100% foolproof. But they're also on the lookout from almost like a policing point of view to make sure that what goes up on their sites is hopefully to the best degree possible a sort of trusted information. We ourselves also, in terms of our press conferences and so on, always make the point that people should go to trusted sites. Don't go to this site that has sort of a, I don't know, who knows what kind of organizational name. Go to the ones that hopefully people will recognize are trusted sites, like our own site, canada.ca, /coronavirus in English. Also, c'est disponible en français. Or as well as the World Health Organization or the Centers for Disease Control and Prevention in the United States. We also make the point with our regular press briefings to hopefully give what we call good, trusted information to Canadians. And I'll just also say that we're also looking at hitting all Canadians and all sort of demographics across different platforms. So I'm not sure if you may be aware, I was sort of asked to do a series of interviews on YouTube to try and hit a younger demographic that might not necessarily look at what we call traditional TV sort of channels. And so from what I've seen or heard from my own children, in fact, is that it's been, I think, successful, and that there's been quite a number of hits or views on YouTube. They contacted in a good collaboration with the Government of Canada, sort of 4 major influencers, and we did interviews, and apparently the uptake among their audiences has been good. So that's, I think, some of the ways we're trying to hit misinformation. Thank you.
Thank you. I'll be sure to look to search for that YouTube clip.